It is my pleasure to introduce Mimi Cunningham, our guest educator today for our education session on Eat Well, Be Well. And Mimi is a registered dietitian-nutritionist and a certified diabetes care and education specialist. Her practice focuses on diabetes management, education, and training. Currently, she coaches and supports people with diabetes referred to Idaho Nutrition and Integrative Wellness. Her background includes working for the Idaho Department of Health and Welfare, managing chronic disease programs for diabetes, cardiovascular disease, stroke, and oral health. She currently writes a healthy eating column for Smart Strategies for Successful Living. Over her career, she has taught nutrition at the college level, served on the board of directors of the Idaho Food Bank, worked with Idaho Community Health Centers to improve standards of diabetes care, and worked in public policy at the federal and state level to reduce food insecurity and improve access to medical nutrition therapy. Her education includes a BS in Food and Nutrition from Carnegie Mellon University and master's degrees in Nutrition and Counseling Psychology from Immaculata University. She sees healthy food as good medicine and believes all of us should get back in the kitchen. Welcome, Mimi, and thank you so much for joining us this morning.
Well, thank you, Dara. It's really my pleasure, and I'm so happy to present, and thank you for inviting me to do that. So I first wanted to say thank you to Grant for his wonderful presentation about Meals on Wheels and his dedication to assure people who need a good meal get to eat well. And part of what he said, a lot of what he said fits into exactly what I want to say, so it'll be a good segue into my message. So I have a couple of thoughts this morning. So one of them is, why pay attention to nutrition as medicine? What are the key issues, health issues impacting the mature adult, and how do we manage food and nutrition challenges during the mature years? So in answering those questions, I often find myself passionately getting on a soapbox about healthy eating. So I'll try not to get carried away this morning because I can. But let me ask you all this. How many of you ate breakfast this morning? Or did you just simply have a cup of coffee? Or did you have coffee and a banana? Maybe something else. But hopefully you all ate breakfast. That's one of my big messages for everybody. So what I'd like you to do as you listen to this is have a little assignment here. Please pick 3 takeaways that you will implement in your life or the lives of the people you work with or serve. I want you to try to find things that you can use out of my presentation. Okay, so you have a picture here of good medicine or bad medicine. Yummy pancakes. So the no-brainer question is, do you think this is good medicine or do you think it's bad medicine? Next slide. So this particular picture of pancakes comes from the International House of Pancakes. About 3 years ago, they advertised this following message: serving up that Saturday morning feeling all week long with a new limited time menu of cereal, pancakes, and shakes. The IHOP culinary team joined forces with Cinnamon Toast Crunch, Captain Crunch's Crunch Berries, and Fruity Lucky Charms. And this is to create a pancake and milkshake lineup full of wow-worthy flavors, eye-catching colors, and plenty of cereal to add that familiar crunch to your breakfast. Well, the good thing they did was they used cereal, which is fortified with vitamins and minerals, as all cereals are. But oh my gosh, can you imagine the calories in that particular meal? And is that good for us? Is it good for our kids? So you can answer that question real easily, I'm sure. Next slide. So what is our problem in this nation? Is it genetics or lifestyle? So I wanted to share a little bit of what the background is, and this is what's facing our mature adults and a lot of younger people before they even reach that age. In the United States right now, the overweight and obesity rate is 74%. And of that 74% of adults over the age of 20, obesity is at a rate of 43%. This has increased over the last 20 years dramatically, and following it are a lot of the chronic diseases. So you'll see a parallel between the increase in weight and the increase in the number of cases of diabetes, for example. So what is this overweight issue causing chronic diseases like heart disease, stroke, cancer. 13 or more cancers are lifestyle cancers. They can be prevented with a better diet and a better weight going through adulthood. Type 2 diabetes, and I know this is my specialty, so I talk a lot about it because it's the one disease that has tons of complications associated with it, such as gastric reflux disease. And obesity is fueling this diabetes issue with the complications, I should say, too. So we've got GERD, we've got sleep apnea. Many more people are using a CPAP to sleep adequately, which is a challenge. Joint replacements, very hard to carry that much weight on a bone frame for decades. We see more chronic kidney disease with people who have diabetes, and we're also seeing a new concern called non-alcoholic fatty liver disease, which is a form of cirrhosis, not caused by alcohol, but in this case caused by so much fat being processed through the liver that some of it's getting stuck in the liver and is creating fatty deposits. So this is a big challenge to try to keep a healthy nation. Next slide. So let me just tell you a little bit more about why diabetes is a big problem. 13% of Americans over the age of 20 have known diabetes. So that's quite a significant percentage. Of people over the age of 25 or 65, 29% have known diabetes, and that includes 5% undiagnosed. We're doing a better job of diagnosing diabetes, so more and more people are being diagnosed with it. So it looks like the number is higher, but we're still able to calculate the undiagnosed. So that's a big problem for our healthcare system. Also, we know that about 38% or 96 million people have prediabetes, and only 19% of those people are aware of it. So we have this large group of people with the chance of developing diabetes somewhere in their lifespan. So risk factors if you have diabetes, that includes cardiovascular disease and dementia. I recently attended a conference where a Johns Hopkins medical researcher, was saying that it's such a big problem now that they're calling it diabetes of the brain. So it's a real serious piece of healthcare and quality of life going forward in our adult years, our mature years. I mentioned that some of the complications include neuropathy, numbness and tingling in the feet, chronic kidney disease, retinopathy, which is a vision issue, and surprisingly poor oral health. So if you have diabetes, you have cardiovascular disease. Diabetes is an inflammatory condition. It drives plaque into the blood vessels, and so it's a big warning that not only do you have diabetes, but you also have a cardiovascular disease. Next slide, please. Okay, so the question is, too much of a good thing for too long? Or SAD, the standard American diet, which is processed foods, sugar, fat, salt, large portions. Over time, our portions have become larger. A bagel used to be a petite little thing. Now it's a very large thing. Sodas used to be very small. Now they're very large. Portions in restaurants are much bigger than they ever used to be. If you sit in an airport for a layover, for example, sit near a restaurant area, you can watch the portions of the servings people are buying as they're waiting, and they're carrying those away, and they're huge. And if you look at a group of 10 people, you'll see that statistic of 7 out of 10 people in that group of 10 could lose weight. So it's a problem you can see in the public, and we want to kind of look at that as an influence on quality of life going forward. Next slide. Okay, I wanted to share with you, we don't have to have poor quality of life from our diseases. There is a study called the Blue Zone Study, and what the researchers have found is that there are 5 areas in the world that have people who live into their hundreds, well into their 90s, and very many living into their hundreds. That's Okinawa, Japan, Sardinia, Italy, Nicoya, Costa Rica, Icaria, Greece, and Loma Linda, California. What these populations have in common is that they live near the sea. There are communities near the sea, so there's access to fish. Some of their characteristics are a Mediterranean diet, which I'll talk about in a few minutes, all plant-based diets, and include wine, except for Loma Linda, California, which is a Seventh-day Adventist community that seems to have this wonderful longevity, but they don't drink wine because of their beliefs. Some of the characteristics include socialization. This is something that Grant brought up in his presentation about Meals on Wheels. This is completely a wonderful opportunity for people to gather together and complete that life on a daily basis, where they talk to other people, they eat with other people, and it's great conversation. They manage stress, they meditate, they nap, they exercise, walking, and gardening. Walking is a big deal for these populations. Purpose, they have meaningful activity and they're engaged, and some of them are working even in their 90s. So it's a big piece of life, is having purpose. So I left you a link to this, and I think you'll find it quite fascinating, just fascinating on any level. Next slide. So here's an example of what I would call the Mediterranean diet, or a diet that is just super, super healthy. If you look at that, you will see, first of all, beautiful, colorful food, a balanced diet where there's very little fat, very little meat fat, red meat, mostly plant-based, olive oil-based, just rich in antioxidants, and just super, super healthy. If we could eat this way, we would be guaranteed some longevity, I'm pretty sure. It's a wonderful way to reconsider our current fad diet. Next slide. So here's an example of the Mediterranean diet. It's basically what I just explained to you, and wine is actually included, which I'm always a red wine person. But anyway, Mediterranean is a really good option. The America's Test Kitchen has a great cookbook on implementing the Mediterranean diet. So if you are looking to add this to your way of eating or changing, I would suggest their cookbook. Next slide. Okay, so why is healthy food good medicine? Well, it's pretty obvious. Vitamins and minerals, really rich vitamins and mineral levels in this Mediterranean or plant-based kind of diet. Phytochemicals. Phytochemicals are wonderful essentials for an anti-inflammatory approach to eating. They're not required for sustaining physical life, but they come in a rich assortment of fruits and vegetables, especially berries. The deep purples, that would include purple cabbage, purple onions, those purples and those reds, wonderful options for anti-inflammatory additions to your diet. Omega-3 fatty acids, they also are anti-inflammatory. So fish, nuts, avocados, great sources. They are a balance of proteins, carbohydrates, and fats. They're rich in fiber. And so I always think about these colorful foods as offering the best nutrition. One of the things that we don't talk about enough is adequate hydration as part of good medicine. Seniors, or I should say mature adults, are often dehydrated, not knowing they are. And the reason for that might be a lack of a sense of taste or a sense of smell. They just don't recognize they're thirsty. And they also may be concerned about incontinence. If I drink too much, I have to go to the bathroom and it might not work really well. There might be difficulty in ambulating. And so without those senses and those concerns in place, you might not drink as much when you're older. And if you're helping and caring for somebody who is older, encourage hydration as much as you can and as much as they'll tolerate. It also prevents orthostatic hypertension if you're hydrated. It's a low blood pressure issue caused by the blood vessels failing to constrict when a body suddenly takes an upright position. The reason that's a problem is that falls occur. Trips to the ER might occur because the symptoms are maybe a heart attack or a stroke concern. So hydration becomes an important part in preventing that. Also, we noticed in COVID, poor nutrition, obesity, and diabetes increased risk. So one of those things is making sure that we have an adequate immune system so that the next time we are affected by a virus that was this deadly, that we are prepared physically to counteract it. Okay, next slide. So there's a new term coming out called Imflammaging, and it goes around with, comes around with inflaming parts of the body, the inflammation that occurs with aging in the blood vessels, in the brain. And if you think about our immune system reacting to inflammation, such as an acute event, which might be a cut where the body has to repair itself, needs the immune system to step in, send white blood cells in place to prevent infection if there's an infection opportunity. But when we look at it as chronic inflammation, we look at it as oxidative stress. In other words, when cells are exposed to oxygen, they produce something called free radicals. Those free radicals are harmful. I mean, it's just part of the cellular process. But if you have antioxidants available because you've eaten those in your diet, it reduces the free radical byproduct, and that keeps cells healthy over time. So that's part of where this inflammaging is coming from. So we look at genetics versus environment. Genetically, do we create just the aging process where inflammatory processes occur, or can we address the environment? Some people will say, yes, I'm born this way, but maybe environment becomes a place that we can manipulate it. You can look at it like a loaded gun. In other words, the bullet's in the chamber, but if you pull the trigger, it shoots. But if you have the genetic predisposition there, that if you don't pull the trigger because you've used good habits throughout your life, you can prevent some of this inflammation in the aging process. So again, focus on diet, the Mediterranean approach, or a DASH diet, which is a very plant-based approach, which is called Dietary Approaches to Stop Hypertension. That's a way of keeping that inflaming process or inflammatory process from affecting you as you age. Also reduce processed foods and saturated fat. That helps quite a bit too. I'm bringing it up again just to kind of reconfirm what to look for. I'm so devoted to this that I can't help myself showing you again. Okay, next slide. So what happens with nutrition during the aging process? Because it's a major determinant of aging well. We know this. Over a lifetime of good nutrition, people tend to age well better. Use the blue zones as an example. because nutrition has been in place throughout every decade of life. The poor nutrition over time does affect how people age, because if you haven't eaten a diet that's plant-based, but you've focused on lots of saturated fat, meats, cheeses, foods that cause you to gain too much weight and create an inflammatory process because you have cardiovascular disease or diabetes, that affects how we go into our older years. The progression of chronic disease affects the aging process. The aging process also creates a decline in sensory function, such as a decline in appetite. We have impaired sensory hormones in place. So when that happens, people just don't have as robust an appetite as they used to have. They don't feel like they can eat as much because their impression of being full or satisfied is impaired, because the hormonal environment around the digestive process is not as robust as it used to be. The other thing that we have facing people is abnormal gastric motility. In other words, your digestive system is working constantly through a sensory process with the nervous system. And without gastric motility, constipation occurs because the intestinal tract is not squeezing and pushing and squeezing and pushing the waste products after metabolism and creating a bowel movement. So gastric motility becomes a challenge. The other thing that's going on too is that the synthesis of protein, in other words, the protein that we eat, doesn't work as well in terms of muscle tissue building and maintenance. I'm going to get into that in a minute when I talk about sarcopenia, but protein is not as utilized as it once was when we were younger. The other thing that happens is that the ratio of lean tissue to fat tissue shifts to a higher fat percentage. So one of the things that happens, well, I'll share that. Let me just hold that thought. But I do want to share two patients I've just recently seen who both of them have diabetes. One is 72. He has had diabetes for a long time. He needs a knee replacement. He weighs 300 pounds. He can't ambulate, and his surgeon will not do surgery on his knee because he needs to lose 40 pounds in order for the surgery to be effective or possible even. So this man happened to be a chef all of his life, so he just embraced food too much, didn't eat well, and now he's facing this challenge. He can't improve unless he loses 40 pounds. So I'm working with him to do it, and he's very focused, and he may get it done, and I applaud him, and that will help his diabetes management as well. The other patient I've seen recently is 35 years old. He weighs 356 pounds. He's just been diagnosed with type 2 diabetes, but he has a chance. He's smart. He's very motivated by a clear vision for his health in 1 to 2 to 5 years. We talked about that. He wants it so badly because he wants to be a dad to his kids. So here is a young man that's half the age of the chef, and he is focused because he has a future in front of him. So hopefully both of these men can make it work. So I wanted to throw that out to you because it's an example of how our nutrition needs to be in place early on. But we also have a chance to implement good nutrition at any age. So that being said, we have hope always. Okay, so let me go to the next slide. Okay, so I was mentioning something called sarcopenia. This is a challenge for older people. It's a loss of skeletal muscle and function after going through life, because at age 30, we've built our muscle mass and our skeletal bone structure up until the age of 30. And after the age of 30, each decade we see a tiny bit of loss of muscle mass. And that continues. And I always think of Tom Brady. He's still a quarterback at the age, in the ages of, he's in his 40th decade, his fourth decade. He's in his 40s, and he's still got the muscle mass to be able to be this amazing quarterback. He's lucky. A lot of us just continue to lose our muscle mass just over time. And once we reach the age of 75, that muscle mass seems to accelerate. Don't know why 75 is the magic number, but it seems to be when things really start to accelerate in terms of loss of muscle. So what can we look at to maybe slow it down? Well, one of the things is that we are seeing now that a lot of people lack vitamin D. And so doctors, and even myself as a dietitian, I always look to see, are you taking your vitamin D supplement? Because most likely you're not getting enough vitamin D, which is fortunately activated by being out in sunlight. But now we're worried about skin cancer, so we're lathered up with sunscreen, and that keeps us from getting the ultraviolet light, which triggers the development of vitamin D. The other thing that's happening is that we may not be getting adequate calorie and protein intake. Grant mentioned this, that, you know, this is one way they're getting healthy food to people, and Meals on Wheels. And I love that they're focused on how do we make this work. Protein. It's a big deal. I mentioned before that protein intake and lack of vitamin D are also aggravated by obesity and diabetes. So we need to make sure that if we're caring for people, that we figure out how to get them some better protein, more protein. We have a vicious cycle going on. We have muscle loss, which creates a decline in physical activity, which creates more muscle loss, which also creates more decline in activity. You just don't have the muscle to ambulate as well, or to walk as fast, or to do gardening, the pleasures of life. So we lose our quality of life. Along with that, we are at increased risk for falling. Prevention, vitamin D supplementation, calcium supplementation, reviewing current diet to ensure protein and calories, physical activity, including resistance training. I put a little link to an article in there if you are looking at wanting to know more about sarcopenia and how it affects seniors. Next slide, please. Okay, so looking at the challenges in terms of potential vitamin mineral deficiencies. So we're trying to protect bone loss, because osteoporosis is a big issue for especially thin white women like myself, and most seniors are at risk for this, or most mature adults, and men too. They have more bone muscle or bone mass, but they are at risk for osteoporosis as well. So calcium and vitamin D, or the medication that we can now give that helps prevent bone loss and osteoporosis. Some of the B vitamins that are missing are B12 and folic acid. These affect cognitive function, nervous system integrity, and prevent anemia. So one of the things about B12 is interesting. B12 is only available in meat products. So if somebody is a vegan and isn't getting any meat in their diet, they are at risk for B12 deficiency. And B12 is activated in the stomach with something called the intrinsic factor. And as people age, that intrinsic factor in the stomach digestive process may be deficient or missing. So if you are concerned about somebody's nervous system not working well, or they're not clearly thinking, that they are frail, have their physician check their B12 and their folic acid levels to make sure that there isn't something that's affecting them that could be easily corrected by supplement. Zinc is another area that people might be deficient in. You've heard me talk about meat before and kind of limiting that, but zinc occurs in meat products too. It supports the immune system, it supports cognitive function, and it has some anti-inflammatory qualities to it too. It's an essential mineral, and one of the things in COVID was they, in their research around why were people more at risk, it was because their zinc, their vitamin D, and their vitamin C levels were lower than people who didn't have a severe response to COVID. Vitamin C is also an antioxidant, supports the immune system. So those are the vitamins and minerals that I think are essential in the mature adult to make sure they are getting adequate intake in their diet. If they aren't getting it, a supplement is a really good idea. Okay, so next slide. One of the things that affects nutrition is the mouth. Oral health is a challenge for the mature adult in some cases. Ill-fitting dentures could be a problem with chewing. Gum disease, painful gums. Diabetes affects oral health because of the bacterial level is higher in somebody with diabetes because there's sugar involved. Blood sugar affects the bacterial amount and actually helps it flourish in the wrong way. There's also lack of access to oral health care too. People in long-term care settings may be affected more by poor oral health care because they don't get to see a dentist. Dental care is expensive, and if somebody is impaired in terms of taking self-care, taking care of themselves, they may not be able to brush their own teeth. Poor oral health ultimately impairs the ability to eat a variety of food. So pay attention to that because it does affect nutrition. Okay, next slide, please. Okay, I've talked a lot about nutrition, but there is a big risk for malnutrition, and it's called frailty syndrome. So I created a link there for you to go and read more about that. So what happens is during aging, there is decline in the physiologic reserve and function across multiple organ systems. In other words, all of our body systems are not functioning at the level they did when we were younger. So because of that, because our digestive system is one of those organ systems, it leads to increased vulnerability for adverse health outcomes. So poor nutrition over time, chronic disease, chronic inflammation, and obesity create a frail environment or a frail outcome for people. So going into the hospital, there's a slower recovery, there's greater mortality, and there's greater risk for poorer outcomes long term. So if we work harder before people really need to be hospitalized for some reason, for surgery, for cancer, for whatever it is that's causing them to be hospitalized, we need to figure out how to address that frailty prior to an acute event. So we are seeing now one of the ways of looking at that are the nutritional beverage supplements. We need to do more malnutrition assessment in the mature adult, especially people in their late 70s and 80s, and even older. That has to become part of our medical care system as a preventive effort. Okay, next slide, please. Okay. So ultimately, what makes a difference? We talked about socialization, access to good food. Food insecurity is a big problem. The cost of food is stressing what we get to eat and what we get to buy. And I'm very passionate about the food insecurity issue that we're facing. Even though I'm not involved with the Idaho Food Bank at the moment, I know they are going nuts trying to get food distributed to the food pantries and to the food banks in the communities that need it. So if you are passionate about food insecurity as well, please donate to the Idaho Food Bank and to your local pantry. They need it so they can buy the food to help support the community that's in need. Social determinants of health is another big issue. People who are at low socioeconomic status, uneducated, at risk because they can't get to a physician, access to health care. These affect how people age. It's a big problem in maybe not so much in Idaho, but maybe in big cities where people just are at risk. Stress, sleep, physical activity, these also make a difference. People don't sleep as well, they're more stressed, they may have depression. Physical activity is minimal. So we have to look at all these elements of how a person matures in their aging process, and can we do something about any of these aspects because they all feed into nutrition. Let people talk about their food as emotion because they can talk about stories in childhood. Some of them are good, some of them are bad, and they do affect how we eat as adults. Okay, so I'm winding this up. And so I've left you with a couple of resources for addressing nutrition for yourself and for the people you serve. And I do want to kind of just throw out a couple of reflection questions or statements. Good health or poor health outcomes start way before our mature years. So think about that with family members who are younger, the generations coming before us. What we choose to eat over a lifetime is either good medicine or bad medicine. It doesn't hurt to start with good medicine today. And it should never be too late in life to address nutrition as an important part of medical and life care. So I trust you picked up 3 things you want to change to improve your own nutrition or that of the people you work for or in programs you serve. So lastly, let food be thy medicine and medicine be thy food. Hippocrates was smart years and millennials ago. Anyway, if you need to refer somebody to Idaho Nutrition, here's the website and the information to reach us. We'd love to have the referral. So I'm open to questions at any time. I know this is a recorded session, but please feel free to reach out to me. I'd be happy to answer any questions or provide some support. Thank you so much, and thank you for all you're doing for our community.
Well, and thank you for joining us today, Mimi, and for making sure we got this important content to our members. And we will get this also posted to our website so that it's available for the community as well. So thank you for sharing your time and wisdom with Learn.